Hey everyone, I'm Dan Dean. Are you looking to improve the look of your face, but just don't want any scars if you get something done? Have you been thinking about maybe getting a facelift or a brow lift, but just aren't sure if it's the right thing for you? Well, if you've been asking yourself these questions, you're in luck. Because on today's episode of Three Big Questions at Rush, we're going to be talking to Dr. Michael Egerstadt about how you can improve the look of your face in a minimally invasive manner. So, Dr. Egerstadt is a facial plastic and reconstructive surgeon at Rush who's done hundreds of these procedures and will talk you through what your options are. It's so great to have you here, Dr. Egerstadt.
Thanks for having me.
So, question one is I did not realize that there were so many options for facial rejuvenation, especially ones that were minimally invasive. Can you talk us through some of what those options are?
Yeah, absolutely. There's a lot of options that patients may not have never heard of. They've heard of facelifts, they've heard of rhinoplasty or nose job kind of surgeries, and they've probably heard of some of them. They've heard of Botox and they've heard of fillers in the face. Of course, these are on social media everywhere. These are things that patients typically know about and have seen or had friends that have had this done. Those are commonly done. They can be done by surgeons such as myself and then as well as dermatologists and others. We find that those are a little low bang for your buck. They're really good at kind of preventing things and for really early changes, but maybe not as robust as some of the other minimally invasive techniques. Some patients have been moving from those towards things like laser resurfacing and chemical peels. Those can be really good to rejuvenate the skin. They're not touching the deeper tissues in the face, and so patients with really advanced facial aging are not going to benefit from those as much. One of the really, really heavy-hitting things that my patients really love is getting liposuction under the chin lipo, neck lipo, things like that. Now, the purpose of this podcast or meeting is, no scars. Truthfully, with neck liposuction, we do make about a less than centimeter incision in order to get the liposuction cannula in there. But I still put that under minimally invasive because, a sub-centimeter incision is going to heal beautifully in most patients. One of my personal favorites, actually, for early facial aging, especially in the mid-face, is called a mid-face lift. That does require an incision, but it's tucked way back into the hairline and there's no incisions on the face. And we can get a pretty good lift in someone's mid-face, kind of get more volume in the cheeks there and reduce these nasolabial folds. That's a really, really nice add-on to other procedures, or people just do it just that standalone. And then the last one that's minimally invasive because there's no external incisions, but really kind of good bang for your buck on downtime is lower blepharoplasty. And so that's where we can get rid of the eye bags in someone. And believe it or not, we actually do that by making an incision kind of on the pink part of the eye, so that there's no external incision, no scarring. Really, really high yield for patients, and patients tend to be really, really happy.
Wow. These sound amazing. This leads me to ask you my second question, which is what are the pros and cons of some of these minimally invasive procedures?
Yeah, that's a good question. The major pro, or a couple major pros, is reduced downtime for these. So for these interventions, we're really not having a ton of downtime, less swelling than we'd associate with something like a facelift, and then no incisions or minimal incisions. So patients who say, I have minor changes, I'd like something done, but I'm not willing to accept the incisions of a long incision from a facelift. These are perfect. And so those patients find that they have reduced downtime. They're back to work pretty quick. They're back to feeling like they can be out and about and in their social circles and not feel weird about how things are looking while they're healing. And so reduced downtime is a huge factor for a lot of my patients, especially patients who are working and have front-facing jobs. Similar to that, a lot of these interventions are more cost-effective. We always compare to the gold standard, right? And the gold standard is facelift. And so a lot of these interventions are a lot more cost effective than a true deep plane facelift would be, or a facelift would be. And so patients opt for these, and maybe these are as a bit of a stopgap for a few years or even a decade before they undergo something more major, or maybe they say this is it. Whatever I kind of derive from this procedure is what I derive. And a lot of patients are really happy about the cost effectiveness of these. And then the last thing would be I would say these have, a reduced risk of what we'd call like major complications, right? Overall, all the cosmetic surgeries of the face tend to be very safe. That's why we perform them at kind of such a high rate. But these ones that are less invasive, therefore, have like a lower risk of major complications. And so patients who are pretty risk averse with their face or just in general, sometimes will opt for these less invasive procedures as a bit of a way to mitigate that risk. And that, I support that as a reason to do these. The downsides of these, are you're going to be able to guess, and that's that they do have more modest results than some of our more robust, facial rejuvenation procedures. Sometimes they require multiple treatments, so depending on which one you're talking about, but things like Botox and fillers do require multiple sessions oftentimes. And same is true with things like laser resurfacing. Sometimes we'll have to do repeated treatments to really get the result that we want. And then the results tend to be a little less durable. So a nice deep plane facelift, which we use as kind of the gold standard, we can say this is going to last you probably 10 years, whereas it's hard to say that with some of these less invasive procedures. And so the durability of results can be, a few years, 5 years, something like that. But you're not going to find that they last as long as some of these more Cadillac, more invasive procedures that we do.
Okay, so now I'm kind of thinking in my own mind, like, okay, if it were me, would I go the more minimally invasive route, or would I go the traditional surgical route? And so my third question to you is, how does one know whether to choose either option? Like, what track do they go down? How do you advise patients to think about it?
Yeah, well, you, Dan, you're nice and young. So young patients with early aging changes will typically say, go with some of these minimally invasive procedures first. We take it patient by patient. If the patient comes in and really their only concern is the lower eyelids, then of course we're moving more towards blepharoplasty and these sorts of minimally invasive procedures. Older patients with a lot more going on, more advanced aging changes, they're going to benefit more from some of these more invasive procedures such as facelift, neck lift, brow lift, things like that. And so just different for every patient. But again, younger patients, less advanced changes, they're really good candidates for these minimally invasive techniques. But the most important thing is you just want to be sure that you're consulting with a surgeon who performs the full spectrum of these. If you're a hammer, all you see is nails. And so if you're a provider who really is only doing injectables like Botox and filler, you're going to probably steer patients towards that. Whereas if you do the full spectrum, like me and my partners do, you're going to be able to steer the patient to what's right for them. And so that's my only kind of real recommendation, is just be sure that it's someone that you trust, someone who's going to direct you well, and someone who practices the full spectrum of these procedures.
Well, Dr. Eggerstad, thanks so much for talking through these options and joining us today.
Yeah, of course. Thanks, Dan. It's great.